do it.
You're on.
Yay, awesome. Well, thank you all for joining us today. I know it is the middle of the day. I hope you're on your lunch break, got some food, coffee, tea, water, whatever you need. I am super excited about this topic. I guess I should introduce myself first. I am Shaniqua James. I am one of the facilitators here at Gilda's Club. I have been here for almost 2 years with Gilda's, and I can't leave. They have wheeled me right in. So I will be presenting on a topic that is very near to me. When I'm not at Gilda's, I'm actually full-time working as a mental health therapist. So I deal with a lot of depression, grief, and things of that nature. So that makes me excited to present on this topic. So the name of this topic is Why Can't I Stay Positive? Depression, Grief, Resilience. I will be going through a presentation that was put together by Gilda's and the cancer support community. And, if you guys have any questions, feel free to either press the raise your hand button. Annie can let me know. I can't see you guys. So Annie can let me know if there's a question or if you guys have any comments or anything. We'll also save some time at the end of the presentation for questions, which is my favorite part of the presentation, usually. During the presentation, there are also some brief moments where we'll take some moments of reflection. And during those times, if you guys have any questions, again, feel free to put a question in the chat, use the raise your hand function, whatever you need so that we can get those answered. All right, let's get started. So if I mess up, sorry, I'm not that technologically savvy, but I'm going to try my best. All right, so why can't I stay positive? We'll start with the mission of Gilda's, which most people know, but it is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community, which is one of the many reasons why I came to Gilda's myself. Again, just as a disclosure, this presentation was put together by the cancer support community. The content was independently developed. All that fun stuff. You guys can read over that if you'd like to, but not truly pertinent to what we're going to be talking about. All right, so here is the overview. This is just our way of sort of acknowledging what we're going to be going through today. So setting the stage, we'll talk about depression and cancer. We'll throw in some things about caregiving and depression as well, grief and cancer, resilience and cancer. And then of course, we want you guys to have the resources that you need. And just so that you all know that there are resources available when dealing with this topic of depression and grief. All right, so setting the stage. As most people already know, there are very universal challenges when it comes to living with cancer, right? Like there's that piece of like being alone, financial burden with medical bills and things of that nature, still having to pay your own bills, right? A loss of hope, there's so many unknown things related to cancer. The loss of control, there's not a lot that you can control. There's a lot of chaos that sort of comes with it, especially if it is a new diagnosis. And then just living with, again, that uncertainty overall in general. And all of these things can really create some symptoms that are significant and sort of align with depression and anxiety. On the next slide, we're going to look at some statistics that was developed by the Cancer Experience Registry and the Cancer Support Community's Research and Training Institute. So I don't know if you guys can see it too clearly, but as you can see, these are some of the concerns, like the top 10 concerns that people have when dealing with cancer. So the top one is eating and nutrition. And then we have cancer progressing or coming back, which is reoccurring. We have worrying about the future, expressing, physical activity and things of like that, exercise, feeling too tired to do the things that you want to do. Health insurance and money, sleep issues, just the changes that your body goes through. So like body image and things of that nature, moving, being able to just move in the way that you used to. And then of course, like the disruption that cancer causes again in all of your life, just the absolute chaos around that. So the Cancer Experience Registry patients and survivors, so 49% of the people who participated in this particular study were at risk for clinically significant levels of anxiety. Again, like we mentioned before, cancer changes all areas of your life. There's so many different adaptations that you have to have, but then there's also the unknown of what is to come, which can cause people to get anxiety symptoms. And then also 38% of respondents were also at risk for clinically significant levels of depression that the study found as well. 49% of those respondents were, had worse anxiety than the national average. And then 34% were had fatigue worse than the national average. And then 39% said that their health was somewhat worse or much worse than before they begin their caregiver role. So we're not only looking at people who are living with the cancer, right, who have the actual diagnoses, but also the people who are caregiving for those individuals, right? I think it's an upheaval for all lives involved, whether you be family, friends, or the person actually living with cancer. There's so much that is unknown and so chaotic with it. So these figures sort of report that. So living with uncertainty. About 53% of the people who participated. Yeah.
I got a question and sorry, I wasn't fast enough. Are they comparing people who have cancer to others without? That's a good question.
Are they comparing in the study?
Mm-hmm.
Let me see. So with this one, yes, they are doing a comparison to people who are diagnosed with cancer to people who do not have the diagnosis. So they're putting it up against the national average for individuals diagnosed with depression and anxiety, and found that these figures are much higher for those dealing with cancer. That's an amazing question. Any other ones? I guess I should pause and see if there are any questions. You guys, I can talk, okay? So please feel free to stop me.
I will, don't worry. But that's the only one I see right now. So go right ahead.
Okay. Perfection. All right. So living with uncertainty. So going back to that study, 53% of those respondents indicated that they were worried about the future, right? Which is a pretty normal response when you are dealing with cancer. Again, I'm going to continue to repeat this. Like, there's so many unknown things when it comes to cancer, not only about the actual diagnoses, but your life beforehand, right? You're having to make so many adaptations, so many changes to your life, and again, those around you. So having to like put plans on hold, right? Like if you have vacations that are planned, it's like, I don't know what that's going to look like a week from now, a month from now, or even a year from now, which can put a lot of worry into people's lives. And then about the fear of just treatment in general. Is it going to work, right? Like we hear all these horror stories about cancer treatment and whether or not it's going to work. And, you know, when you hear the word cancer, it's automatically like not a very positive connotation around the word cancer, right? So naturally your mind sort of goes to the treatment I'm going to get. Am I going to get sick? You know, do I have to cancel and change everything? Is it even going to work? And that's just sort of what this particular part of the study shows as well. It's like living with uncertainty and how significant that is. See, you guys that went backwards, this is what I'm telling you about technologically savvy. All right. So resources, what depletes our resources, right? When it comes to these diagnoses, living with cancer, being a caregiver of someone who has cancer. And these are just a few, right? Like this is not all inclusive, but definitely unmanaged distress, untreated depression, unrecognized grief, and limited social support. I can tell you one of the most significant things in my own cancer story is having that limited social support. Feeling like, okay, I can do this, I can do it by myself, I don't need the help. But then when it comes down to it, I'm just absolutely exhausted. So very important, that limited support, that limited social support. And then we'll go through different kinds of grief that you can experience with the diagnoses of cancer or being a caregiver of someone with cancer. But one common one that I see a lot is anticipatory grief, especially with new diagnoses. All right, so let's talk a little bit about distress. This is my favorite part, being a therapist. It's like, let's talk about these symptoms. What does that mean? All right, so distress is a mix of anxiety and depression, and it can cause a lot of different symptoms, right? It can cause sleepiness, lack of appetite. It can cause trouble concentrating, difficulty carrying on activities that you typically do. And, you know, a part of that is normal. Again, when you're experiencing a really significant life-changing event, like a diagnosis or becoming a caregiver with someone with cancer. And so about 5% of those who are diagnosed with cancer obtain psychological help, which I'm just like, right? And I think there are a number of reasons for that, which we will go over a little bit later in the presentation, but it's quite a low number. But if you can look at the figure here, it says cancer can bring a mix of emotional, physical, spiritual, and practical concerns, right? Emotional distress is often ignored. Don't ignore it. Hashtag please don't ignore it. Put, parentheses around that exclamation point. Please do not ignore the symptoms that you are experiencing or noticing, whether it be your loved one or yourself. And then think of distress as another vital sign, not as something that you should just live with, right? And so when we talk about mental and physical health, we should really put them under one pillar. They're all about our health, right? We need to look at it as a whole system and not just siloed. So if you're noticing any mental health symptoms, whether it be that, that significant loss of things that you like to do, increased loss of joy, things of that nature, please recognize those signs and get help that you need, going to your oncologist, your doctor, whoever that might be. All right, so this is a little fun activity that we can take a moment to do, and then I'll also pause here to see if there are any questions from the first half of the presentation that anyone might have. But if you guys can, just look over this document here and then rate these things on a scale of 1 to 5 about how concerned are you about, right? So just going through these things, communicating with your doctor, changes or disruptions in work. And if there are any questions that come up, let us know. Put it in the chat, raise your hand. Again, I can't see it, but I'm sure Annie can. And should we give like 3 to 5 minutes, Annie, before couple of minutes?
Yep,
okay.
That sounds good to me.
Perfect.
I'll stop recording for these 3 minutes too, because we don't need to just look at you, do we?
Are we good to keep going? I don't know how long it's been. I don't have a clock here either.
I think we're good.
Okay. All right, so we will continue on. We won't collect these numbers, but this is just a way for you guys to gather this information and sort of look at it as a baseline, right? Sometimes it's helpful to be able to actually write these things down and see something tangibly, to really understand like where your concerns lie, to be able to address them, right? And so the next slide is just a reminder to tell your healthcare team about any concerns that you have. There is literally nothing too large or too small to tell your healthcare team about. And I know for some people that can be quite intimidating, and it does sometimes take a lot of advocating. I am a proponent of advocating on every level. So, so I definitely encourage you to be able to have those conversations, or even if you feel like you need a loved one to sort of help you carry out these conversations, to do that. So, all right, and don't forget to ask for support and resources, which Gilda's has an abundance of resources for you all, whatever that might look like, and the staff is fabulous at finding things that people need. So, all right, let's move on to positive thinking. So I will read this quote from Jimmy Holland, who was an MD, "The burden of positive thinking. It's bad enough to have cancer, but when all of your family or friends are saying that you have to be positive and you have to fight this thing, and the patient is exhausted and beaten up by the treatments, it seems to me that adding the burden to be positive was just ridiculous." I really want to take a moment and, pause a little bit here and talk about, that burden of positive thinking, right? I think sometimes when we hear that big C, it's sort of like a societal norm for us to take just a very brief moment to sort of pause and think about what having cancer actually means, and then you immediately have to get into the fight. And that is just not a realistic way of thinking, right? I like to tell people it's okay to sit in that pit a little bit, but just don't live there, right? I mean, again, this is a big life-changing sort of diagnosis, and it's okay to feel sad about it. You don't always have to be positive about it, and it's just not a realistic way to think either. And sometimes that can definitely become a burden. So I always encourage people, especially when talking about friends and family members who say things like this, just to remind them gently, right? Like, sometimes you have to remind people like, okay, the only kind of support that I need from you right now is just to tell me I'm good, right? Like, I don't need you to say, oh, just be positive, right? Like, you have to tell people how to support you sometimes. So I always encourage people to do that, just to alleviate that burden of positive thinking sometimes. All right, so let's talk a little bit about the tyranny of positive thinking, right? So it's really the inability to acknowledge that cancer is difficult and frightening experience, right? Sometimes when you hear those things like, oh, you just have to fight this thing out, it sort of minimizes what that actually means, right? Especially if it's not the person going through that cancer battle. And then there can be, the insistence that you have to put on a happy face. You have to pretend that you are happy all the time, even though you have this huge life-changing thing happening to you, not only physically, but emotionally, right? Again, when we talk about cancer and having that diagnosis, it changes every aspect of your life. And having to make those changes is not easy. And then, of course, there's the guilt, because you can't maintain that positive attitude, right? Because that sort of expectation of having a positive attitude about cancer was placed on you. And when you just don't feel like you can do that, you start to feel guilty a little bit about it. And then again, the belief that having a wide range of emotions is unacceptable. So when I said earlier that it's okay to sit in that pit, just not live there, please excuse my language, but I mean that to say the pit of shit. And what that is just the place where you sit, where you are sad, you are feeling all of the emotions, right? Like it's a dark place sometimes. It feels kind of hopeless sometimes. But it's normal. Like, let's normalize having these feelings, especially around cancer, and having feelings that you can't be positive sometimes, because I know it's an expectation, but it's not a realistic expectation, right? And so that's just a part of the burden of having that positive thinking sort of placed on you a little bit. So here we have another quick reflection that we can do. We'll maybe spend like a minute or two on this one as well. But we have a question here. So in your experience with cancer, have you felt pressure to think happy, put on a smile on your face, and find a silver lining in any of this? So let's just take a couple of minutes. You guys don't have to respond to this aloud, just to like write something down or just reflect internally about it. And then we will move on to the next phase of the presentation, which is talking specifically about depression and cancer.
I added in the chat that I hear this often when talking with our members.
Yes. Mm-hmm. That's one reason why I really love these support groups, because it's a safe space to be able to say things that, out in the world, you probably wouldn't get the best looks about saying. Speak freely and honestly.
Mm-hmm.
All right, let's jump in to the next part, talking about depression and cancer. Ta-da! All right, so again, my favorite part, psychoeducation about what depression actually is. I know there are so many misconceptions about what depression looks like and how people experience depression. And I wanna let you know that it is individualized, right? Like, it's common for people to have certain symptoms that relate to one another, but individually, people can experience cancer very, very differently. So we'll just read through these and then we can continue on with the presentation, talking a little bit more about depression. But everyone can feel sadness at times, but that doesn't mean that everyone has depression. Right? Depression is generally characterized by a depressed mood or loss of interest or pleasure. Symptoms must be persistent over the same 2-week period, and symptoms must cause clinically significant distress or impairment in activities of daily life. I think the purpose of this particular slide when discussing depression is so that we make that distinction that depression is a lot more than just feeling sad. Like, you can absolutely feel sad and not have depression. It is a combination of all of these things. And that is outlined by the DSM-5, which is the clinical diagnosing book that most psychologists or therapists use to diagnose people with depression, anxiety, and other mental health disorders. And so that is outlined there. Depression can also look like agitation that's outside of your norm, right? Trouble concentrating on things. It could be, even thoughts of like wanting to harm yourself, things of that nature, right? So it can be a lot of things. There are a lot of symptoms that are associated with depression that goes outside of just sadness. And they do have to be pretty significant that they are interfering with your functioning in some sense. Like for some people, depression causes them to sleep a lot more, right? So like if you're sleeping so much and still waking up incredibly tired, and you're not able to go to work, that would be considered clinically significant in the area of functioning. So again, I would encourage people who are experiencing any of these symptoms to go see someone, a therapist, or talk to your primary care doctor, to get the help that you deserve and need. So the next slide, what does depression actually feel like? So we'll go through like some mood related symptoms and on from there. So depression can feel like feeling sad, feeling hopeless, feeling irritable, feeling numb, feeling worthless, feeling down. So that hopelessness, specifically that hopelessness, is associated with cancer would look like feeling like immediately, once you get that diagnosis, there's no point in doing the treatments because you're just gonna, perish anyway. Things of that nature. Like you don't see any hope for the future. That numbness is not feeling anything at all. Feeling like there's just nothing there for you to feel at all. And then of course, worthlessness, things of like, oh, I deserve this, I'm a bad person, things of that nature. So, and again, this is not in a complete list of mood related symptoms to depression, but these are some of the more significant ones that we see often. And then physical symptoms, right? You can have insomnia, loss of appetite, hypersomnia, libido issues, and fatigue. And I know with this one specifically, it's a little bit more difficult when we talk about cancer, if you have a diagnosis of cancer, just because some of these correlate with like the treatments that you have, or like the cancer itself in general, like the fatigue, appetite loss, things of that nature. So with this one, I would specifically talk to your oncologist about that and making sure that we're sort of comparing it with like what other symptoms are we noticing that would align with depression as well, right? So like that hopelessness, the numbness, the worthlessness, and things like that. And then we have behavior symptoms, right? So loss of interest in activities that you used to enjoy, crying all the time, withdrawing from your friends and family, loss of motivation to do daily things. Again, some of these sort of correspond with the cancer diagnosis or treatment that you're getting. So making sure that you're talking to your healthcare provider so that we can make that differential diagnoses. And then cognitive symptoms. So, memory problems, trouble focusing, difficulty making decisions, and negative thoughts. I think for me, the one that stands out the most for the cognitive symptoms would be the negative thoughts, specifically negative thoughts about yourself. Again, just, feeling like you're worthless, things of that nature. And then, of course, again, the memory problems and the trouble focusing can be in correlation with the cancer diagnoses and the treatment. So again, making sure that you're talking to your healthcare providers. I'm going to repeat so many statements in this presentation, but that is okay. All right. So what do we actually know about depression? It's a lot more common than we think it is, especially in cancer patients. So about 1/3 of cancer patients report a mood disorder at some point over their diagnoses within the first year, causing the greatest risk too. And then 10 to 20% of cancer patients are continuing to report depression, anxiety after the initial distress of diagnoses when they are diagnosed with cancer. So 15 to 25% of cancer patients experience depression. Depression affects patients with cancer at 2 to 3 times more than the general population. And then depression affects men and women with cancer equally. I want to take a quick pause here. And Annie, are there any questions in the chat, any hand raises before we move on? Just want to make sure, because we're getting into that fun stuff with the numbers and the studies and all that fun stuff.
I don't see any chats currently or questions currently, but if anybody has one, now's your chance.
Now is the chance to dance. Okay. Also of note, it is also reported that more than half of cancer patients report fatigue, and those are just survivors. So survivors of cancer report fatigue even after going through treatment and things like that. So an ongoing issue. All right, so what else do we know? So this data actually comes from the 2020 Cancer Experience Registry. Depression, that cancer can impact a patient's life in a variety of ways, right? So like quality of life, it decreases adherence to cancer treatment, and longer hospital stays it can lead to. And 38% of respondents reported substantially worse anxiety than the national average, which we found out earlier. And then 26% of respondents reported substantially worse depression than the national average. So a little bit of repeat information, but some ways that we know depression can impact cancer patients. And how so? All right, and again, we just want to stress here to talk to your providers if you are experiencing any of these symptoms. I promise you are not alone. It is okay, and it is a very common thing. So let's get rid of the stigma around it. All right, so again, what do we know? How are we treating depression, right? So there are a number of ways that depression can be treated, and these are just a few of the different types of modalities that we can use to treat depression. So we have like behavioral therapy. Again, that would be going to see like a mental health therapist. Cognitive therapy, again, you would see a mental health therapist. That's just type of modality. So like the way they would be treating the depression. Interpersonal therapy, again, the way that would be treating the depression. And then we have exercise and mindful interventions. Excuse me. And we will go through each of these. Excuse me. All right. So in addition to those, we also have medications. And there are different types of antidepressant medications. We have SSRIs, SNRIs, and tricyclic antidepressants. It's usually recommended that people get a combination of antidepressants and mental health therapy for the best results when it comes to cancer, or excuse me, depression. Generally, antidepressants can take 3 to 6 weeks to actually start working or for you to feel any effect of the medication. And they're typically started at really low doses and sort of tapered up as you go, just depending on whatever, your symptoms are. And so actually starting at the low doses really helps to avoid any side effects that you might have. And it's much easier to switch an antidepressant at that low dose than it is if it at a higher dose. And so I would be sure, what is going on here? Haha, there we go. Okay, you guys got to see the slides earlier than before. I would be sure to talk to your healthcare provider if you do have like family members who have been on antidepressants before, or if you've had a negative response to an antidepressant before, just so they are aware and can put you on the best possible medication. And I know there are a lot of questions regarding medications, but I would be sure that you talk to your healthcare provider, your doctor, about what your best option would be. All right, now we can move on. So now we're moving on to grief in cancer. There's a really lovely quote that I want to read with you guys. We shake with joy, we shake with grief. What a time they have, these two house, as they are in the same body, by Mary Oliver. All right, so grief and cancer. I think grief is a topic that is more commonly talked about when it comes to cancer. And there are a few different kinds of grief that we can experience, right? So we have living loss, ambiguous loss, loss of the assumptive world, disenfranchised grief, complicated grief, and anticipatory grief. So we'll start at the top with living loss. So living loss is basically how we experience chronic or ongoing sorrow. It's the space between what is actually happening and what could have been or what should have been, right? It's that place between, being where we are and then sort of recognizing where we wanted to be, right? So it's like living with the things that you wanted to do in your life, right? So again, an example would be once you're diagnosed with that cancer, sort of living with, oh, I was supposed to go on vacation and now I can't go on vacation. That would be considered a living loss. Another form of grief is that ambiguous loss, right? So that sort of involves a sense of loss that may be unclear and sort of defies any resolution that could possibly be. Like you feel a sense of loss, but you don't fully know exactly what has been lost, right? So like there's so many unknown things related to this ambiguous loss. And then the loss of assumptive world. this was actually developed by Kaufman, who I believe he was a psychologist. So this means that, you know, typically a developed sense of world and develop assumptions or beliefs that help us feel in control and give us a sense of security and stability. And so that's loss, right? Like that's a kind of grief, like losing that sense of security and stability. That's what loss of assumptive world would be. All right, disenfranchised grief. This is grief when, you know, it's sort of invalidated or minimized or not publicly acknowledged. You feel a sense of loss that is not recognized by people around us, or, you know, when people say things like, oh, you should just be happy, right? Like that, again, going back to that burden of positive thinking, oh, you should just fight through it. You should just be happy that you're still living. You should just be happy that, you know, treatments have evolved as much as they have. So that is that disenfranchised grief, which oofta. All right, and then we'll move on to complicated grief, which is losing a loved one, which is, you know, one of the most distressing and unfortunately common experiences people face. And experiencing normal grief and bereavement have a period of sorrow and numbness, even guilt and anger. And these do ease at some point, but for some people, complicated grief, these feelings sort of sit. They don't really improve at all, even as time sort of passes. I've heard people sort of describe it as just a constant numbness or like a really deep pain that they can't figure out, and it doesn't feel like there's any resolve to it. And then there's anticipatory grief, again, which has been most commonly sort of talked about in at least the groups that I run at Gilda's and in therapy sessions is, okay, what I know this is going to happen, right? So say that a family member has been diagnosed with a terminal cancer, right? There's no way of knowing when, you know, that will take their life and things of that nature, and, you know, all the changes that come with that. So that's sort of anticipatory grief. It's like knowing that it's going to happen, but not knowing when it's going to happen and what is it going to look like after it happens. But just having that understanding that at some point this cancer is going to take my loved one's life. All right, so those are the different types of grief in relation to cancer. Oh, this is lovely. So activating hope. And then after this, I promise we'll take a little bit of time for a reflection, and then any questions if you guys have, please let me know. So hope dies last. And so activating hope, how can we do that? Right? Using self-compassion, finding meaning in life, acknowledging and not avoiding, reducing isolation, and cultivating resilience. So let's just take a moment and have you guys reflect a little bit. Again, you can write it down, sort of do it internally. You don't have to share with us here in the presentation. This is just for you. But what are you grieving about, right? Like, what are you grieving right now? And how do you feel like you can honor and acknowledge your grief? One part of the healing process is being able to accept that something is happening to you, right? Even though it sucks, even though we may not like it, a part of being mindful is recognizing that it exists. So take a couple of minutes, about 2 to 3 minutes, and reflect on that for a little bit, and then we will move on to the next part of the presentation. All right, so this is now my favorite part, right? We get to talk about, okay, we talked about all these terrible things, the grief, the depression, the anxiety and things, but now what's next? Let's talk a little bit about resiliency and cancer. All right, again, a very lovely quote. Resilience refers to an individual's protective attributes and or personal characteristics, which are thought to be modifiable and to promote successful adaptation to cancer, including, among others, meaning and purpose in life, sense of coherence, self-esteem, self-efficacy, cognitive flexibility, coping, social support, and spirituality. So I think this just sort of gives us an all sort of inclusive way of defining what resiliency actually is. And, you know, you can define it individually, whatever that looks like for you. But resiliency is an active process of facing adversity related to cancer experiences, the ability to restore emotional and physical functioning when confronted with stressful life events. It is not something that people either have or do not have, which we are all resilient in every way, and also involves behaviors, thoughts, and actions that can be learned and developed in anyone. Excuse me. All right. Mindfulness. This is actually my favorite. All right. So cultivating resiliency through mindfulness. So mindfulness can be super helpful for a large range of reasons, including like helping with depression symptoms, anxiety symptoms, stress, all kinds of things, excuse me. And it really is about paying attention on the purpose, right? Paying attention to the present moment without judgment, right? So not paying attention to what's to come, what has been, what should have been, just really paying attention to what is going on right now. And that could be with your body, where's your mind right now? What do you feel in your body? Things of that nature. I really, really, really encourage mindfulness. It's a really effective tool when it comes to anxiety. There are a ton of resources for mindfulness these days. You can go on YouTube and just Google it, mindfulness for anxiety. You can do like a meditation. They have different mindfulness stretches, really, really good ways for you to be able to connect with your mind and body and just be present in moments. And it has a lot of benefits too. It can help with like sleep, functioning, focus during the day, things like that. All right, so here is another reflection activity. I think we're gonna skip this one because it's kind of a long one, but I wanted to pause. Are there any questions that we have at this point?
I don't see any, but let's give them a few seconds to see if anybody types anything in.
This is a beautiful picture. I would totally want to do some mindfulness with this picture hanging in the background.
I want to go there in person. Forget the picture.
Yeah, we could really use some scenery these days.
Mm-hmm.
All right. Anything come up? So I'm gonna keep on trucking. Okay. Yep. All right, perfect. So what are some daily activities that you can take when it comes to mindfulness, right? So looking for the good. And this is completely different from positive thinking, right? Because looking for the good means that we can find something good in the moment that we're in. Not that we have to be positive absolutely all day and find a silver lining. And then 10 mindful minutes. I don't know if you guys have iPhones or have Apple Watches, but there's like breathing apps that you can put on your phones. The Calm app I know is a really popular one. I know that Netflix and Hulu has the Calm app and another one on their streaming services so that you can, take 10 minutes and do a mindful activity. Other things that would also be considered mindful activities is like coloring. I know that sounds really childish, but I have 4 kids. So coloring is a really good mindful activity. Just going for a walk and like recognizing the nature, right? Like listening to the birds, things like that. That's totally a mindfulness activity. That's pretty simple. And then acts of kindness, believe it or not, but I believe humans are inherently good. And there's just something about doing something kind for someone else that makes us feel good on the inside. So, sharing that kindness with other people is a really good way to also implement some mindfulness into your day. So if you're a coffee drinker, I really encourage you to buy People's Coffee, specifically at the Starbucks in Ramsey at 7 a.m. because that's when I'm usually there. If you guys are ever in the neighborhood, just saying. All right. So what are some key takeaways from this presentation? Well, distress and depression are absolutely treatable. They are absolutely normal. Let's break the stigma that depression and anxiety have to be treated by yourself, that you are alone in that journey. Not at all. Resilience can be learned and strengthened. Positive thinking is not ever the goal. Acknowledging grief matters, and you don't have to do this alone, which I'm going to continue to emphasize. You do not have to go through this cancer journey alone, and there are resources available for you if you are experiencing depression or anxiety. And then resources. So I'm sure you guys already know Gilda's excellent resource. Again, Gilda's has resources with mental health therapists and things of that nature for people who specifically are diagnosed with cancer, if you need that resource. But Gilda's is an awesome resource. And then there's also a cancer support helpline. And then, of course, these are the people who have helped us with this. Also, it's not included on here, but there's also a national hotline for suicide if you are feeling suicidal. You can always Google that. Most counties have a crisis number as well if you're experiencing really extreme mental health symptoms. And also there's also a text line that you can use for mental health symptoms if you just need someone to talk to as well. I know that there are also walk-in mental health clinics. If you don't want to see a regular mental health therapist, you have the option of going into one of these walk-in clinics, seeing a person for one time, and then never having to see them again. So that too is an option.